Western New York prepares to start the next phase of reopening. Leaders in Erie County are still keeping a close eye on the impact the virus is having in our area. And joining me right now to talk about this is Erie County Health Commissioner Dr. Gail Burstein. Dr. Burstein, thank you so much for joining us and taking the time to speak with us today.
Sure. Thanks for inviting me. Good afternoon.
Good afternoon. So we reached a new milestone in New York State today. Hospitalizations dropped below 1,000 for the first time since March 18th. So what's your reaction to that? And how do you think we got here, in your opinion?
Well, it's great news. So it tells us that we are doing a good job flattening the curve, and we know that we look at our numbers with our hospital admissions and our proportion of positive tests in Erie County and through the Western region and all of New York State. We know that we're on the downside of the curve. However, I just want to caution people not to become complacent because the COVID-19 virus is still here. And we got here by being compliant with feeling good about social distancing, wearing masks, washing our hands, doing everything we can to keep safe and preventing coronavirus transmission within the community. And we still have to keep doing that to keep our numbers down. And again, just because the numbers are down doesn't mean coronavirus has gone away. It's still here, and we have to do everything we can, continue wearing masks, continue washing our hands, continue social distancing, to keep those numbers down. And then now in New York State, we're one of the states that has a very low community transmission rate. And so now we have to be careful about traveling to areas outside of New York State where they have a very high proportion of positive tests. Because just remember, at the beginning of our COVID-19 epidemic, we were seeing viruses come in through travel, like people from Europe and Southeast Asia, and we were screening for that. And so now we could be in the same situation, even just looking at people traveling in the United States into the areas in the South and to the West, where they're seeing a higher prevalence of COVID-19. And we don't want Erie County residents traveling to those states and possibly becoming infected because their travel restrictions are different and people are going out and enjoying themselves because they're on holiday, they're not wearing masks, they're going to the beach, they're going to crowded restaurants and bars, and then coming back infected and then importing cases into our community. And then that'll result in not only imported cases, but when they're interacting with other people in our community, it'll start a whole new chain of community transmission. So that's why we have to be smart about not only what we do within Erie County, but also what we do outside of the county and outside of the state.
Now, something that was mentioned during the county news conference yesterday, we are seeing more new cases diagnosed in younger people. That includes infants and children. What do you think the cause of that and a spike of those cases could be?
Well, we working with our excellent contact tracers, we're strongly encouraging cases to make sure that all their close contacts are being tested. And so if a case is somebody in a large family, has a lot of kids in the house, then those kids are being tested, and we're finding that many of them are positive because they're close contacts living in the same house. Also, just in terms of young adults, people in their 20s and 30s, we know that many times, they're going out, they're going to the restaurants and to the bars and to the beaches, and so getting exposed. And so, we may be seeing higher numbers because those individuals are going out and there are more opportunities for community transmission, anytime you go out. So I think it's a combination of testing close contacts, family members that include kids, and also the younger people, going out and, possibly being exposed in the community. Whereas the seniors, they know that they can get very, very sick when they get COVID-19. So they're still staying indoors, we believe, for the most part. When you see, pictures that, you show on the news that people out in restaurants and bars, many of those individuals are young. So just want to remind everybody, if you do go out and it's beautiful weather and we just want people to enjoy the outdoors, if you're going to go to a place where there could be other people, bring a mask. You see somebody else outside your group or your family members, wear that mask. And remember, we wear a mask to protect each other. So when I'm out, I'm wearing a mask to protect you, and I expect you to wear a mask to protect me. And that's the way that we keep the community transmission down and break that chain.
And when we're talking about the spike in children in particular, how concerning is that, and how could it affect schools reopening in the fall?
Well, we'll have to see what happens with schools. So, we know that children do get infected. I think that we know that children are less, in the general, are less likely to become symptomatic. Of course, there are children that have become very very ill with COVID-19. Where in general, we think most of the time children aren't as ill. So. I think in the past, before we started being aggressive about testing contacts or close contacts, that many children were not being tested because they didn't have symptoms. And so now that we're testing close contacts of family members that are children, we're testing more kids that are being exposed, and so we're finding more cases. So that's something that we're going to have to think about in schools. We know that New York State has released guidance for higher education, colleges, and universities about what type of safety measures to put in place to keep the environment as safe and healthy as possible. We're still waiting for the state to release guidance on schools for K through 12 and also pre-K, and we'll see what that shows.
And when we talk about possibly entering phase 4 in Western New York next week, a lot of people have been talking about the fact that a lot of people thought gyms, movie theaters, and shopping malls would be included in phase 4, and they're not. Why is it not safe for those places to be included in phase 4?
Well, they're not included in the initial part of phase 4, but phase 4, it might be a little bit longer, and that could. We're hoping that those guidance will appear later in phase 4. But we know all those areas are closed spaces, and places like movie theaters and gyms. I mean, there are going to be people that are going to be close together, like breathing, coughing, sneezing, eating. That are have sputum when they come out and they talk, or they're breathing very hard in a gym. It can be very difficult, I think, to exert yourself and wear a mask. It could actually be dangerous. So I think in places like that, when we have to figure out better ways of how to keep it safe, it's good to be careful and just give the state some time to really think about the best way to open so that people that use those places stay safe. I mean, we know that it's like a risk stratification, right? And so if people are working out, like running outdoors or swimming outdoors, then you're not in a closed space, so that reduces the risk of community transmission. However, if you're exerting yourself indoors, then the sweat and the sputum, or if you're in a movie theater and people are coughing or they're eating popcorn so they don't have their mask on, I mean, that provides opportunities for transmission through infected droplets. So I think that the state is trying to be thoughtful about it, and we're waiting for guidance to see how we can open these places safely.
93% of people in Erie County still have not contracted the virus. That's the latest numbers from the county news conference yesterday. What is your reaction to that as we prepare to head into phase 4? Do you expect to see a spike in cases because of that as we head into phase 4?
Well, remember, we still have a very small proportion of the Erie County residents who have been tested for antibodies. So we're just saying of the people that have been tested, only about 7% tested positive. However, we know that we really believe that many people, most of the people in Erie County, have been infected with COVID-19, and so we also we're hoping that there is some type of antibody protection from natural infection, and so we believe that most people in Erie County are going to be susceptible to a new infection of COVID-19. Hopefully that we will, in phase 4, people will still continue the protective behaviors of wearing masks, social distancing, washing their hands, and wearing masks are so important of keeping these numbers down and preventing community transmission. So we're hoping that even though we progress to phase 4, that people continue to be compliant and continue to adhere to the guidelines of wearing the mask when you're out in public, to social distance and washing your hands, cleaning, and that the operators of facilities are very vigilant about cleaning frequently touched surfaces to prevent community transmission. And hopefully we'll get into phase 4 and get through this without a huge spike. But we'll have to see. It really depends on all of us to do our parts, whether we're in phase 4, 3, or we have to go back to phase 2, whatever phase we're in, it's still the same basic tenets: wearing a mask, social distancing, and washing your hands. And I think that is really what is driving our numbers. And so if people can do that, whatever phase we're in, I think our numbers hopefully will be able to stay down, because that's really what is predictive of where our epidemic is going, is by people wearing masks, washing their hands, and social distancing.
Okay, Dr. Gail Burstein, thank you so much for joining us and filling us in on the very latest on COVID-19 here in Erie County and, of course, Western New York as well. We really appreciate you taking the time.
Yeah, thanks for inviting me.